this was a very novel ASH in the fact that we could not actually meet our colleagues in person, and it was all virtual, but also it allowed us to be able to view many abstracts in a continuous and on-demand fashion, which was also very handy, not minding all the physical effort of changing rooms. I have three big themes that I would like to emphasize from this year's ASH. One is that we're making big strides in understanding the pathogenesis of these diseases, particularly the driver mutations and the inception of those cancers that can occur multiple decades prior to clinical diagnosis. So based on very eloquent work by multiple groups, we've been able to identify driver mutations that occur in utero, before childbirth, in infancy, and in young adulthood, multiple years prior to the disease onset, which will have us rethink our perception of myeloproliferative neoplasms, as well as our treatment targets and treatment goals and measurements of success. It will start a different kind of discussion with our patients about how did these diseases occur and how long have they been happening, and this will have multiple implications for MPNs and other myeloid cancers. Another interesting theme that we've been discussing this year in ASH is that the concept of improving overall survival was not on the table much for patients with myelofibrosis. But now with ruxolitinib and momelotinib and also the telomerase inhibitors, imetelstat, we're actually discussing overall survival advantages of those drugs, as well as designing clinical trials with overall survival being the primary endpoint, which is a new step for us in studying these diseases. And we're all excited about that concept. And then the third biggest highlight is that the standard of care, which has been single agent JAK inhibitors for the last 10 years, is being challenged with many clinical trials being designed in first-line setting with combinations that can modify and change the first-line therapy as we know it right now. And there's three contenders in first-line setting: a PI3K delta inhibitor, a Parsaclisib, a BET inhibitor, as well as a BCL-xL inhibitor in combination with ruxolitinib. So all these agents are in first-line setting now and being investigated to challenge what we perceive as first-line therapy. So hopefully in 3 years or so, we will have a different discussion on what is the first-line therapy in myelofibrosis.